As a meteorologist, there's nothing better than forecasting a beautiful sunny day. But sometimes the skies turn, and I make predictions about stormy weather so that people can be prepared. However, I was not able to predict what would happen when my son was born. Nothing could prepare us for that. It was as if lightning had struck our family. He had extensive heart defects. His first open heart surgery was at 13 days old, and he will have more in his lifetime. Our child was in the Cardiovascular intensive care unit here at Children's of Alabama, like yours is now, and we were feeling the same fear and anxiety you may be experiencing. But the doctors and nurses here took good care of our son, and they took good care of us.
I'm going to give you your Guardian armband.
The first thing they want to do is keep your child safe. That's why you'll both be given Guardian identifiers. Keep yours with you at all times and never share it with anyone. Your child will also wear one at all times. The identifier ensures confidentiality and gives you 24-hour access to your child's room. What will that room look like? How will you know what to do when your child is here? That's what we're going to cover, so you'll have peace of mind and feel more comfortable in these surroundings. Let's look inside a heart patient's room so you'll know exactly what to expect. When you first enter your child's room, you'll see lots of monitors and alarms. These can be loud and unsettling, but they are necessary. Your nurse will be happy to answer your questions and explain how all this equipment helps them provide the best care for your child. One of the things we appreciated most when we were here was being invited to actively participate in our child's care. It's very comforting to be included and know what's going on. The medical team makes their rounds every day at 9 a.m. and 9 p.m., and it's a great opportunity for you to ask questions. Children in this unit, which we call the CVICU, have complicated challenges, but the more you participate, the more you'll learn. The medical team also wants to learn from you. Any information you can provide about your child will help everyone. Children's of Alabama wants you to have as much information surrounding the care of your child as possible. That's why they have a policy to teach all parents about CHAT. This is a code word that stands for Children's Hospital Assessment Team. You can use it if you feel your child's condition is critical and needs a rapid response team to provide immediate medical attention. You can pick up any phone in the hospital and call 8CHAT or 82428. A nurse and a respiratory therapist will arrive within 15 minutes. However, you'll be glad to know that calling CHAT from the CVICU is never necessary because the highest level of care is provided here. This unit is unique because nurse practitioners and doctors are present 24 hours a day. No one has to be paged. They're all right here at all times. If you ever have an urgent concern and you don't see your nurse nearby, use the call button at the bedside and someone will respond. You are your child's best advocate and support system. This includes making sure that every time someone enters the room, they gel in and gel out using the hand sanitizers available at every patient room, or they wash their hands with soap and water. This applies to all visitors, staff, you, everyone. Hand washing is very important in this unit to prevent the spread of germs. If you see that someone is not washing their hands, speak up. And another important thing you can do for your child's safety is to be sure the identifier is checked before medications are given. If someone comes in to give medicine and does not check the identifier, again, speak up. I've been where you are, and I know it can be scary. But we are so fortunate to have this magnificent hospital where everyone understands that in order for you to take the best care of your child, you have to take care of yourself. That's why there are programs and services in place to help you.
I would like to talk about the food.
Social workers will help with meals, lodging, and parking. You'll use your Guardian identifier to validate your parking. Counselors and chaplains are available to listen to your individual needs when you feel like you just need to talk to someone. Child life therapists provide age-appropriate support for children and teens while they're in the hospital. Toys children receive here are theirs to keep. Be sure to take time out for yourself at the Children's Harbor Family Center. It's located on Main Street in the Harbor Building. It offers a fitness room, a basketball court, hair salon, nap room, and other services for families and they're all free. Staying energized includes getting a good night's sleep. Every effort is made to keep noise down, but in a critical care unit like this one, there's a lot of constant activity. Hopefully, you'll find the comfortable living space provided for parents or caregivers near the window in each room is a restful place. There's a day bed, cabinets, and a safe to store your things. And there's a laundry room with washer-dryer units and a dishwasher. Please follow all the posted instructions and be mindful of others waiting on the washer. Housekeeping will come in every day to clean your child's room, and they're always available if you need extra help. Just outside the patient area is the waiting room. There's a kitchenette with a coffee maker, a microwave, and drink station. You're welcome to store food in the refrigerator if you label it with your name and the date. If your child is not able to eat, please eat in the waiting area and not in the patient's room. The waiting area is where your family and other visitors will arrive to check in. Visitors are encouraged to come see your child and see you. It does everyone a world of good. All visitors coming to see inpatients must check in at the information desk to receive a special badge. It will have a barcode that must be scanned to gain entry into the CVICU. It will not allow you to enter any other areas. Different codes are used for parents, siblings, and visitors. Visiting hours are 9 a.m. to 9 p.m. Only 4 people are allowed in the room at once. There are special visitation guidelines for respiratory season, which is usually from October 1st to April 1st. We'll review those guidelines with you during this time of year. The unit is temporarily closed for shift changes from 6:30 to 7:30 a.m. and 6:30 to 7:30 p.m. This is to protect your child's confidentiality during medical report time. Sometimes the hall will also be closed so that bedside procedures can be done. If you see this sign, please do not pass through. Now you know the ropes. I hope this tour of the Cardiovascular Intensive Care Unit has helped ease some of your concerns and has made you feel more comfortable. It seems they thought of everything at Children's in caring for their precious patients and the parents and caregivers who love them and stand beside them every step of the way. It's good to know you're not alone here, and at every turn there is someone who wants to help you and your family through this trying time. Before you know it, your doctors and nurses will be talking with you about moving to the step-down unit. That will be a time for celebration as you're getting closer to going home. And I believe that milestone will call for a forecast of a beautiful sunny day.